Welcome to The Explainer. Let's dive into some absolutely wild medical mysteries that completely baffled history's greatest doctors.
Modern medicine is great, right? But what happens when the human body does something utterly terrifying and totally unexplainable?
Picture this, the chaotic, wild frenzy of a 1518 dancing plague versus the eerie, frozen stillness of 1916. In 1518, Frau Truffe just started dancing. Soon, 400 people joined in, dancing non-stop until many literally died.
Doctors blamed hot blood and actually hired musicians. Crazy, right? Modern theories blame stress psychosis or a hallucinogenic fungus.
Fast forward to 1916. A sleeping sickness swept the globe, killing millions and leaving the survivors tragically paralyzed.
The famous Dr. Oliver Sacks described these poor patients as being like zombies, waiting frozen like extinct volcanoes.
Now, deep in the isolated jungles of Papua New Guinea, an even more gruesome medical mystery was lurking.
Locals suffer from kuru, a fatal shaking disease. The cause? Ritually eating the brains of their deceased loved ones.
The culprit wasn't a virus. It was a prion, a lethal, infectious protein without any DNA. Absolutely wild stuff.
Moving to modern times, a simple swim turned fatal for a young girl who encountered a brain-eating amoeba.
The progression is terrifying. It shoots up the nasal cavity, causing severe brain inflammation, seizures, and unbelievably rapid death.
But honestly, the absolute most bizarre mystery has to be the 1994 case of the toxic lady.
While dying of cancer, Gloria's body radiated toxic fumes. A staggering 23 ER staff members fell violently ill. Doctors literally fainted just from standing near her. The whole emergency room had to evacuate into the parking lot.
So, what happened? Was it just mass hysteria, or did her self-medication actually form a vaporized toxic gas?
Finally, some anomalies feel like pure science fiction, like the incredibly creepy alien hand syndrome.
Your hand involuntarily levitates and literally acts on its own. Treatment totally depends on the underlying brain disorder.
Science explains a lot, sure. But what bizarre, undiscovered anomaly might be hiding inside your own biology today?